supporting individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports regardless of income or disability. So this series is around opening doors to integrated supports. We have two different monthly series. So this series, Opening Doors to Integrated Supports, we have two different monthly events. Today's event is the Missouri Open Door Benefit Series, where we focus on eligibility, specific services in Missouri. Some are state and some are federal programs. And so what that green portion of the star is needs-based services. That could be on your age, your geography, income level, employment status. Those are all the government paid services that might be based on disability or diagnosis, such as special education or Medicaid. Here is more information about each series. Our benefit series, the meeting that we're all on now, is the second Wednesday of every month from 12:30 to 1:30 Central Time. On August 13th, our next will be about adult protective services. So we hope that you can join us then. The next technology series is July 23rd, and that supports for neurodiverse needs. It's on the fourth Wednesday of every month. This slide features all the upcoming topics, but please visit our YouTube page where you will find an archive of both the benefit series and the technology series. We've had some really great speakers, and they can really educate you about different programs that exist in our state. I'm going to turn it over to Christina Scott. She's the Senior Program Specialist for the Bureau of Senior Programs. She's going to share with us all about serving family caregivers, and I'm really looking forward to learning from her and all the different.
All right, hi. Thank you, Colette. And I will try and get my screen shared here. All right. Are we seeing what we need to see? All right, great, thank you. As Colette mentioned, I am Christina Scott. I'm a Senior Program Specialist with the Bureau of Senior Programs, which is a part of the Division of Senior and Disability Services at the Department of Health and Senior Services. And today I'm going to be talking about services for family caregivers, primarily for those caregivers of older adults. And some other caregiver services that work across the lifespan. So feel free to put questions in the comments. We'll have copies of this presentation available. There are some clickable links in there for accessing the web pages and some of the documents that I'm going to be talking about today. So those will be available to you with the presentation and some additional flyers. But feel free to ask any questions that you have, and I'll try and address them along the way or at the end. So our first and kind of largest area of service that passes through the Bureau of Senior Programs is related to the Older Americans Act. And this is a federal law that was signed by President Lyndon Johnson in 1965 to promote the well-being of older Americans. And most of the funding for the Older Americans Act is allocated through the U.S. Department of Health and Human Services, and then that funding flows down through us as the state unit on aging, and then passes through us out to the 10 area agencies on aging throughout the state of Missouri. So these are our 10 area agencies. I know this map is small, but it kind of gives you a gist of where the different agencies are located. Different states have different setups when it comes to area agencies on aging, but every state in the United States has area agencies on aging that are tasked with serving older adults and caregivers. Um, so you can kind of look and see by county where you might be served. And these 10 area agencies on aging are nonprofit or quasi-governmental organizations that serve in their own areas, and they have some services that are required and others that they provide in addition. So even if you haven't heard of the area agencies on aging, you probably have heard of some of the services that they provide. Um, Many times when people think of services for older adults, they think of senior centers. And there are 214 senior centers-ish throughout the state of Missouri that are either directly or through contract operated by those 10 area agencies on aging. And most of those centers are locations for older adults to congregate for recreational activities, have meals, have educational classes, maybe fitness and wellness classes, and for them to receive referrals to other resources in the area. So, senior centers and home delivered meals are some of the big things where maybe if you haven't heard of an area agency on aging or a AAA, as we call them, doesn't have anything to do with automotive assistance. But the 10 AAAs, if you haven't heard of their names or their collective AAA designation, you probably have heard of some senior centers or home delivered meals um, are some services that they do provide. So all AAAs provide these services: congregate meals, which would be together in one place eating, home delivered meals, information and assistance or referrals to other services, in-home services, like lighthouse keeping and things like that, legal services, the long-term care ombudsman program, and transportation. So what area agencies on aging do varies a lot um, from agency to agency, but they all provide these core services in some capacity or another. And eligibility for area agency on aging services is not dependent on the type of insurance you have or your ability to pay. So donations are welcome and encouraged, but no eligible participant is ever going to be denied services because they don't contribute. And the vast majority of services that are coming through AAAs are not based on whether you have Medicaid or not, or Medicare or any other type of insurance. Um, and donations, again, are encouraged, but they are not required, no matter what your income level or ability to pay might be. So I'm just going to touch on some of the other services. These have been addressed in maybe some other benefit sessions in the past, but just some of the other things that are not specific to caregivers, but can also benefit caregivers and older adults. Um, the 10 area agencies on aging all provide nutrition services, congregate and home delivered meals. Um, Anyone who's 60 or older or an adult with disabilities who lives in certain communities is eligible to receive um, meals at their local area agency on aging. But even if you are not in a qualifying population, a lot of those senior centers have some pretty good meals, and you can go in as a non-eligible participant and just pay the full meal price and get yourself a tasty meal. And there are a lot of people out there in different communities that do that. So congregate meals at senior centers, some other innovative programs that some of the agencies have going on. Um, there is the local one here in Central Missouri, Aging Best, has a food truck where they do mobile, they treat it as a mobile senior center and they can travel around and provide meals from the food truck. Others have like a virtual senior center kind of thing where they receive food um, home delivered, but meet together in a Zoom type meeting like this and still have that interaction with other people to make sure that folks are um, combating loneliness and isolation and things like that, even if they aren't able to leave their homes. So if you're interested in nutrition supports, do reach out to your local area agency on aging. There are also a lot of different supportive services. Anything that's necessary to help older adults stay safe, healthy, and independent in a community setting. Um, Again, as I mentioned earlier, these could be things like minor housework or personal care assistance, could be friendly calls or visits, simple home modifications like grab bars or ramps, um, and many other offerings like that. And these are services that are available to anyone age 60 or older. Again, priority may be given to individuals with greatest economic or social need. The funds are obviously not unlimited, and so there are wait lists in some cases for some types of services. Um, but there are a lot of different types of things that are available for older adults in the community. Disease prevention and health promotion is another. There are lots of very cool classes um, that can address all sorts of needs of older adults. There are Tai Chi and yoga type things, classes that focus on incontinence or medication management or disease management. Um, there are cool things that involve music and like Drums Alive is one where they have big like exercise balls and are beating rhythms out with drumsticks and things like that. All sorts of cool classes that are offered. So many of them are offered by senior centers virtually as well as in person. Um, but those again are available to those who are 60 or older, and they're intended to support healthy lifestyles. We have moving to kind of our main topic, an area that is served by area agencies on aging that people don't necessarily think of are family caregivers. And these are folks who fall into several different categories, but the services that the area agencies on aging are providing are to support the people who are taking care of other people. Um, and the goal is to prevent burnout and allow them to care for themselves so that they can provide the best care to their loved ones. And there are four different categories for family caregiver. So if you are an adult who's caring for an older adult, um, so if you're taking care of a spouse or a parent or a neighbor or something like that, they do not have to be your like blood relative. But if you are a caregiver for someone who is an older adult, then you could qualify for family caregiver services. If you are an anyone 18 plus caring for anyone with Alzheimer's disease or a related dementia. So the person with dementia does not have to be an older adult if they have an early onset sort of scenario or something like that, then you would qualify for services as a caregiver of someone with dementia. If you are an older adult who is 60 plus, actually it goes down to 55 plus. If you are over 55 and caring for a relative under 18, so that's the grand family or kinship caregiver that we often talk about. Um, if you have a child that is in your home when their parent is not in the home, and you are their primary caregiver, then you as an older adult can qualify for family caregiver services if you're taking care of that minor child. And if you are an older adult caring for your own adult child who has a disability, um, then you can qualify for family caregiver services. So those are the four main categories. Um, you could be an older adult who's caring for someone else, or you could be a non-older adult who is caring for an older adult or someone with dementia. Um, the area agencies on aging have all sorts of services available. And this next slide here shows the main categories that those services break down into. Um, Support groups and individual counseling. There are all sorts of different support groups that are available. Each AAA has a different offering, but many times those are online um, and in person or a combination of the two. It might be caregivers of people with dementia or caregivers of people with Parkinson's or cancer or groups specific to caregivers of minor children, like a grand family support group or something like that. Um, Case management or assistance in gaining access to qualifying services. Um, a lot of area agencies on aging will help you navigate through a system that can be confusing and unfamiliar sometimes, trying to find other benefits that you might be eligible to apply for. Gaining, networking your healthcare with your other social and supportive services, and making sure that you can, if the area agency isn't providing that service directly, making sure that they can get you to someone who can provide that service. Um, Information about programs offered directly through contractors or elsewhere in the community. Um, Area agencies on aging are a great referral resource. They can let you know um, what is available in your local community and whether you might qualify for it, and have a warrant handoff to those additional services if they're not providing them. Training and education. Area agencies do a lot of work in the community, providing classes, being out and about at community fairs or health fairs, um, other things out there to let people know that they exist and they're there to help. Um, Many times people can live in the same community where an area agency is located and not know that they're there. And we want that to, people who are in that situation to decrease a lot. We want everybody to know about area agencies and the services that they provide. They also can provide supplemental services and supplies. That could be something like having a DME closet where they have um, rollators or walkers or wheelchairs or hospital beds available. They might provide nutrition supplements like Ensure or incontinence supplies or home modification devices, other safety devices, things like that. And then the final area is respite care. And that can look like a lot of different things. It could be in-home respite with a direct care provider. It could be an adult day program, or any other activity that would give the caregiver a break from their caregiving duties. Here are just a few examples of the types of programs that are available at area agencies on aging right now. Again, AAAs are all their own entity, and while there are guidelines about what sorts of services they need to provide, they have a lot of latitude in how they provide those services, and they tailor things to things that their community is really needing and looking for. Um, so we have area agencies with lending closets that can trade out those needed supplies, like that people might not be able to purchase on their own, and they can borrow or receive those items, and they'll do repairs on DME and turn them back out into the community for additional assistance. Grand Pass is a program that one of the area agencies on aging has for those grand family kinship caregivers, where they provide vouchers for summer camp for those grand families so that kids have an opportunity to go and enjoy something in the summer, and the grandparent can get a little bit of a break from those caregiving duties. Lots of virtual and in-person caregiver support groups, friendly callers and visitors that check in on care recipients. They might give them a call once a week or pop in, just to make sure that that person is okay. Maybe the caregiver is a long distance caregiver and their loved one is mostly able to live independently, but they just want to, they're not able to have eyes on them, and someone else can do that for them, um, just to make sure that the person is doing okay, that care recipient. And some cool intergenerational things going on with like tech tutorials and seminars, for grandfamilies who are having to navigate school processes and things like that, in a world that is probably much different than when they were in school themselves, or even having to navigate those processes with their own kids. Now coming in, years later, things have changed a lot. And so just how do you use Class Dojo, or how do you utilize some of these other things that might not be familiar to them, um, so that they can properly interact with their grandchildren's schools and things of that nature. So area agencies on aging are a great resource and a great place to start, if you are looking for caregiver services as a caregiver of an older adult or an older adult caregiver. But we have lots of other family caregiver resources as well. So I'm going to talk about a few of those that are available, um, either ones that come directly through us, or that we or the area agencies do referrals for. One of those is the Missouri Caregiver Program. Was formerly and is formally known as the Customized Caregiver Training and Relief Program. Um, but Missouri Caregiver Program rolls off the tongue a bit easier. Uh, that is a program that is directly funded through state funding, and it supports caregivers of people with Alzheimer's disease and related dementias throughout the state through education and respite services. It's designed to reduce stress, improve communication, make home safety improvements, um, and provide some partial reimbursement for care-related expenses. So the goal is to give the best quality of life possible for the care recipient, reduce emotional and financial burdens for the caregiver, and let that care recipient reside at home as long as possible. Um, it's currently administered through a contract with Community Asset Builders, and we have a flyer that will be passed on where you can get some additional information, um, and the contact info for them is available there too. But to qualify for the Missouri Caregiver Program, the care recipient needs to live in Missouri, the caregiver must live with them, and the care recipient needs to have a probable diagnosis of Alzheimer's or a related dementia. It does not, there's no like doctor's note required or anything like that. But this is for people living in the community, not those that are already in like a long-term care situation. And the caregiver program has three main tracks. The first one is about training, um, and that provides hands-on instruction and education. There's a home visit, and someone comes to the house and kind of helps you walk through, this is a situation we're dealing with. This is what my care recipient um, is going through. And these are the things that might benefit us now and in the future. And there are trained community health workers, social workers, other folks that make this in-home assessment, provide some needed education and suggestions, and help link the caregivers to other resources as well. Um, the second track is about relief, and it's primarily reimbursement of and financial assistance for assistive technology, um, and respite care, other supportive services. So resources are provided to cover. Um, it's not going to fully, it's not a full, like full-time supportive program so that someone could still work full time and someone's going to come and be with my loved one all day. It is a supplemental reimbursement program. But it can provide in-home care, adult day um, support, short-term emergency placement in a care facility. Say the caregiver needs to go into the hospital and have a procedure themselves, and they don't have someone to stay with their loved one. Um, that loved one could have a short stint in a care facility while that caregiver is in the hospital and recovering. Um, could also be supplies like medications, nutritional supplements, incontinence products, durable medical equipment, things like that. Um, and then the third track is our newest track, and it focuses on providing specifically assistive technology to keep the care recipient safe at home. So that's things like monitoring equipment, security cameras, door and window alarms. It could be other tech like grand pads or um, medical monitoring kind of things like a med timer and things of that nature. It also can help provide the support for like Wi-Fi installation, training on how to use those things. So that the devices can be used efficiently and appropriately. And a lot of the support for this track is provided through a partnership with Missouri Assistive Technology, which I know many of you are familiar with. They help do assessments and break down what might be the best um, tools for that individual with dementia and their caregiver to use and sort of plan for longevity as well, adding additional pieces and making changes so that they can stay safe and healthy in the home for a longer period of time. Another program that is available is the Structured Family Caregiving Waiver. Um, this waiver in particular, none of the other things that we're talking about today are Medicaid based. Um, they don't really have income or insurance requirements. The Structured Family Caregiving Waiver is one that does. You do need to qualify for Medicaid to receive the Structured Family Caregiving Waiver. But it was developed to provide a comprehensive and cost-effective home and community-based service option for people with Alzheimer's or related disorder who want to live at home but would be unable to without a caregiver. So this waiver is somewhat similar to some of the other waivers that you might be familiar with that are available, like the aged and disabled waiver and things like that. So to be eligible for this one, the care recipient must be an adult with Alzheimer's or related dementia. They have to meet the nursing home level of care and they have to qualify for Medicaid. Their caregiver has to live in the same household as them and currently provide unpaid care. So this waiver provides participants with household support, transportation, um, medication oversight, things like that. But again, you do need to be Medicaid eligible for this particular program. Kinship Navigator is another program. This is specific for those grand family kinship caregiver situations. And again, you don't have to be a biological grandparent. It could be a family friend or a coach or a teacher um, that would qualify for these Kinship Navigator services. And Kinship Navigator itself is not a program that is specific to older adults. Um, so for other people who might qualify because you're caring for siblings or nieces and nephews or something like that, and you aren't an older adult yourself, Kinship Navigator is still open to you. It is administered through ParentLink with the University of Missouri's College of Education and Human Development. Um, and there's all sorts of assistance through the Kinship Navigator program, um, specifically for people who are in that kinship setting, whether it is formal foster care that's operating through DSS or informal care that is not has not been formalized and involving foster care payments or anything like that. ParentLink also provides other services that are not specific to kinship caregivers, and I included some of those here. They have a warm line that you can call, and they have professionals that answer and can just answer parenting related questions in general. There's a separate line that is the Kin for Kid line, um, that is tailored for the kinship program, but there are other services outside of that that are also available, including services for incarcerated parents, early childhood support. Um, they have access navigators to help people apply for benefits and um, things like that. But for the Kinship Navigator program specifically, um, it is operated through 3 different family resource centers and Family Forward. Those are nonprofit agencies that cover the state where you are located. Depends, there are resources available no matter where you are in the state of Missouri. These are the 4 agencies: Central Missouri Foster Care and Adoption Association, Foster Adopt Connect, Foster and Adoptive Care Coalition, and Family Forward. Um, Among those agencies, the whole state is covered. So you can get more local supports as a kinship caregiver in those areas. You can reach out to ParentLink and ask for help that way, and you'll get directed to the right place. Or you can pick the organization that is located in your particular area, reach out to them that way. The shared care tax credit is another option to support family caregivers. If you care for a person in your home, you could be eligible for a tax credit on your Missouri income tax return. This supports caregivers who are living with a spouse or parent who is 60 plus, who would otherwise be unable to live alone, and that parent is not receiving Medicaid or SSBG funded services. So if you are a family caregiver or you know someone who might be in this scenario, you can apply for this tax credit. It can be up to $500 or your maximum state tax burden, um, whichever is less. So if you owe less than $500 on your state taxes, it would cover the whole thing. If you owe more than 500, then at least 500 could be covered. And you can go back for 3 previous tax years. So if you're just finding out about this program and you think you might qualify, um, you can get credits for not just the most recent tax year, but you can go back a few years and apply for those as well if you were in a position to qualify. Um, so this does apply to the tax return of the caregiver, not the care recipient. So it would be your taxes and not those of your parent or whoever you are living with and caring for. Um, there is a little bit of a 2-stage process in applying for the shared care tax credit. You have to be deemed an eligible participant first, and that part happens through the Department of Health and Senior Services. And once you get certified as a shared care member, um, you just you fill out a form basically, and they review the form um, and see that, yep, you are caring for this person. They wouldn't be able to live independently without you being there, and you're not being paid to do so. Um, then you get certified as qualifying for it. There's a signature from a medical professional that says, yes, this person is at like a nursing home level of care, and they do need the support of a family caregiver or someone to be able to remain at home. And they couldn't be able to care for themselves, drive a car, things like that. Um, Then as soon as you're certified, then you can apply for the tax credit. It's just a simple tax credit form that goes to the Department of Revenue. Um, you get a letter from the Department of Health and Senior Services that says you qualify. You submit that with the simple form, um, and you get your tax credit. So it's not a huge amount of money, and there is a little bit to the process, but it can just relieve a little bit of burden there, um, for a caregiver who is not being paid for the amount of service that they are providing to their loved one. We also have a lot of other resources out there that I'm not going to call out individually, but we have a resource guide on the Department of Health and Senior Services caregiver page that can be accessed through health.mo.gov. Then you go to the seniors area and go under the area agencies on aging. And there's some resources down at the bottom. It looks like this here on the screen. Um, Missouri resources for caregiving across the lifespan. Um, us here at the Bureau of Senior Programs, along with input from a lot of other entities and organizations around the state, have worked to develop a list of services for caregivers of all types, not just caregivers of older adults, but for those caring for people with disabilities, minor children, things like that. And this is a guide that is searchable by program or organization name, as well as eligibility requirements. So, if you come in and say, well, I'm a veteran and I want to know what other services might be available to me besides things from the VA, you can search and see um, things that require you to be a veteran to qualify for the services or not. Or I need a particular diagnosis or a particular type of insurance. Um, you can filter and search for those um, types of limiting factors and see what resources might be pertinent to your particular situation. It's been distributed across our agency, other relevant agencies and organizations, but we want everyone to be able to access it. Um, and you can, if you search caregiver resources on the DHSS page, or even just like Google caregiver resources in Missouri, um, we haven't gotten the SEO perfect or anything like that, but it does come up. Um, so if you are part of an organization that has services that are not listed on this resource guide, please feel free to reach out. Or if you see an inconsistency, or hey, I know that program doesn't exist anymore, or anything like that, feel free to reach out to me. We want it to stay up to date and for it to be an accurate resource for folks. So please check it out and use it in your particular organization or for personal use. And if you know anything that could be done to update it, please let me know. Resources and referrals. There are lots of ways that you, as someone who works with older adults or for your own personal knowledge, can access these resources. You go to the our DHSS website. DSDS is the Division of Senior Disability Services. Again, that's part of the overall Health and Senior Services umbrella. And we are under DSDS as the Bureau of Senior Programs. You can access our website again at health.mo.gov and go to /seniors and get to a lot of the things that way. We are in the middle of a website overhaul, so hopefully in the near future, it will be even more accessible to folks and easier to navigate. But for now, you're welcome to go to the website and access a lot of these resources. A lot of them are linked there. Um, the senior resource line is an easy first step. Um, that phone number is 800-235-5503. Anywhere in the state of Missouri, you can call that number and put in the zip code where you or the person that you're serving lives, and it will use that zip code to link you to the right area agency on aging for you. So you don't have to worry about I'm in this county, which person, which of these 10 numbers do I call or anything like that, the senior resource line will work anywhere in the state. Um, so that will get you to the area agency on aging. And if they can't help, they will find someone who can. That is one of their big goals, is to have as much of a, I mean, you guys are familiar with no wrong door and things like that. We want there to be ease of access for people to get to these resources. And then the outside organizations that I mentioned today, not all of these services flow directly through us here at the Bureau of Senior Programs, but we know about them and we know that they're great and we want people to utilize these resources. So those outside organizations, a lot of them have great websites and phone numbers and ways that you can get in touch with them, whether it be community asset builders or Parent Link, Alzheimer's Association. There are lots of routes to get to these programs and services. Um, so that is the majority of what I have. Again, I am Christina with the Bureau of Senior Programs. These are the other members of my team. Um, and any of us would be happy to help you if you have questions um, for your own use or for people that you would like to refer. Um, we want you to be able to utilize services as a caregiver, care recipient, or someone in the professional world. So I will end my slideshow there. And I'm happy to take any questions or anything like that if anybody has any.
I don't know if anyone has any questions, but I wanted to give a reminder for those that have participated in the past, or an announcement for those that haven't. We will be sending out a follow-up email in the next few days, and it'll have a PDF with all of these slides so that you can access the information. Kristen also provided a couple flyers about program-specific flyers, so we'll share those with you as well. We will spend a couple days. Our team will go through and kind of edit this just a little bit and get it loaded onto the website archive, where it will also be captioned. So that will be there for everyone to view on the YouTube channel. And once again, we want to thank Christina for coming and giving us such a great presentation and sharing about the caregiver resources in Missouri. Let me check the chat. I think we may have. Oh, just compliments, Christina. No questions.
I'll take that.
Chat thanks you, and Scout says it was some really great info, and he thanked you.
Thank you so much.
Perfect. Well, we'll wrap up just a few early and give everyone a little time back. If you get a chance on your way out, please complete the closing poll. It helps us so much as we plan these sessions and identify speakers. And again, thank you, Christina, for sharing your time and information with us.
Thanks much.